What can you tell us about the meeting this afternoon?
There was wide-ranging discussion at lunch today about kind of how we move forward. I made clear that I had stated back in January that moving forward with repeal without a replacement that we could cite to show Alaskans and people around the country was not a way that I wanted to move forward. I think we recognize that the reform piece of this is hard. It's just hard. You're talking about healthcare that is pretty individual to families everywhere. Everyone has a healthcare story. And it's complicated by virtue of what part of the country you live in. It's probably more complicated in Alaska than elsewhere. And so coming to a consensus has been hard, but I don't think it's impossible. And so I'm concerned that if we just move forward with just a straight repeal with the promise that we'll get to it in 2 years, trust us on this, I think that adds just greater uncertainty into an area and a market that is already chaotic, certainly in the individual market. And so as difficult as it is, I think that we need to figure out what that path forward is, how we're going to reform the ACA, and I think the best way to do it is through a committee process. And maybe we put down pieces of what's in the Better Care Act. Maybe we put down what Senator Graham and Senator Cassidy are now talking about, or what Cassidy Collins was about. But let's move it through a committee process, and let's see what we can't do, and do it in a way that builds some trust from folks that are looking at this process from the outside.
When we spoke the other day, you mentioned that you were convinced that President Trump wanted to do this the right way, that he wanted to get this done and not just put it behind him, that he actually wanted something substantial. Are you still convinced of that after he calls just for a straight repeal and get to the rest later?
Well, I can't speak for what President Trump's desires or intentions may be. I can tell you that as I talk to Alaskans, they don't have a view of just get health care behind you, get the vote behind you. They want to know that we have addressed the concerns. And in Alaska, the concerns are premiums that have risen, over 200%. Folks tell me that for all intents and purposes, they feel like they don't even have coverage because their premiums are so high, their deductibles are so high. So just getting it behind us doesn't solve their concerns. So I think regardless of where you are on the fix out there, people recognize the status quo is not acceptable. So let's work on it. And it is. The president is right in saying healthcare is complicated. And I think we've demonstrated that, but I don't think it's so complicated that we cannot address, again, the urgency, and that's the situation in the individual market right now. So I think what has happened with where we are today is the Medicaid reform, that part of the Better Care, BCRA, that was not part of Obamacare. I think that effort to reform Medicaid has really complicated the place that we are at today. So I suggested weeks and weeks ago, we've got to separate this, bifurcate this, put the Medicaid reform off to the side. Let's focus on the individual market and where we are right now and the urgency to address that. I think if we were to do that, and again, to go through a committee process, I think that we can make that happen. I think you've got good people that are willing and ready to go. I talked to the chairman of the HELP committee. He says he's ready to move to a committee process.
Are you getting any traction with McConnell on separating out Medicaid?
Well, in fairness, I don't think that that there has been that discussion. He has advanced the BCRA, and it clearly has contained within it the Medicaid reforms. I have been consistent with my statements, and I have yet to see that separation, but I do think that is a path forward. And I think that as we're looking for those paths forward now, this is certainly a place to look. One area that I hope that colleagues are looking at is this weekend the governors met in Rhode Island, and there was a great deal of discussion about what is going on here in the Senate and the work that we have done thus far. And the feedback that I got was there is a very great concern about the fact that the states haven't really been involved in this process, a desire to have a more open committee process that would allow for input from the governors, but also that there be this separation of issues. So I think that discussion coming out of the National Governors Association was important, and again certainly is in line with what I've been saying.
How do you reconcile what you're saying today about not voting for repeal without replace with your vote in 2015 on the same bill?
Well, think about where we were in 2015. In 2015, we had 4 insurance carriers that were participating in the Alaskan marketplace. Now we have 1. In 2015, we weren't looking at premium increases above 200%. The facts on the ground have changed since 2015, and I think it's important that we recognize that. And when I say we recognize that, I think as Republicans, we need to recognize that there were some things within the ACA that we liked and that we want to continue. I think most of us believe that making sure that those under 26 can stay on their parents' policies is a good thing. I think most of us believe that ensuring that those with pre-existing conditions are not discriminated against in the sense that they wouldn't be able to purchase policies that are affordable. I think our colleagues on the other side of the aisle, the Democrats, need to acknowledge and concede that not all that was contained within the ACA is good and workable, and that it needs to be fixed. So I think both sides need to come together to recognize that we have a challenge that we share, and it's our responsibility to address it. So I look to where we were in 2015 to where Alaska is right now, and a straight-out repeal with nothing to provide a level of certainty to the Alaskans that are so concerned about where we are right now. If you just say, give us a couple years to work this through and we'll figure it out, I don't think that is an acceptable answer that I can provide to them.
Probably one more, guys. She's got to
Can I ask you, were you aware this morning that you were the third?
No, I was not. I mean, obviously I can count. I know that Senator McCain is not here this week, but now there's some discussion that we would move to this even before Senator McCain gets back. But I wasn't counting or calculating.
So you didn't coordinate?
I did not coordinate. I saw the news last night that 2 additional members had said that the way that BCRA had shaped up was not sufficient to allow them to move to proceed, and so knew that was stalled out. And then I saw the comment late last night from the majority leader saying, looks like we're just going to move to just a straight repeal. And so I had overnight to think about that. I have been going home every weekend. I have been very much in a listening mode as I have been at home, trying to put myself in open public spaces where there's a level of accessibility for people to share with me their concerns, their thoughts, and what I have heard. And this is not just from individuals on the street. I've been talking to those in the provider world, trying to really understand the concerns. And I am more and more convinced that while the status quo is not acceptable, simply saying we're going to repeal this and think about it later, that's not an option for me. In fact, it was not an option for most of my colleagues when we began this in January. There was very much a concerted choice by our conference to go down this path of linking repeal with replace. And I think for good reason. And in my view, that reason still stands.
Okay, so President Trump said today that he would like to just let Obamacare die and move forward, which sounds a lot like maybe stopping subsidy payments. What would that mean for Alaska?
Well, the cost share subsidies, I think, are important to the marketplace everywhere, and it is within the discretion of the administration to make those payments. The president has effectively made that decision on a monthly basis for the past several months. He is not obligated by law to do that. I do think if those cost share subsidies are not continued, again, that just adds to greater uncertainty, which I don't think anyone welcomes. So you ask what it means to Alaska. I think it's broader certainly than just Alaska. Alaska might actually, and I probably shouldn't say this on tape, but I will. I'm just kind of thinking this through. But because of what we were able to do with our own reinsurance, and now with the 1332 waiver that we have received as a state, we may actually be a little more insulated from that if the cost share subsidies don't go down. I'll have to check with my really smart healthcare gurus on this, but I'm just kind of thinking out loud about what the status of that 1332 might allow for us that provides for a little bit more stability. But I think, in fairness, if those are not continued in the very short term, I think it does create real turmoil out there.
And her other meeting has already started, so we need to let her get going.
Okay.
Thank you guys.
Stay tuned. It's been a wild month. Yeah. But I will tell you, I've never seen Alaskans more engaged than where we have been in these past several months as they bring up their stories. I've been part of a lot of tears as people share very, very personal feelings about what has happened within their families. And it's on the Medicaid side, it's on the individual market side. It is very clear to me that this effort does not end if in fact we should move this week and not be able to take the repeal up or take up anything this week. It does not mean that we are done, not by any stretch of the imagination. My hope is that we would begin immediately to move to committee hearings. There should not be a day that we waste in in trying to come up again with those solutions that will give us not only immediate relief in the individual market, but really look to more enduring policies that will provide us the health care that people want and deserve. So we got a lot of work in front of us. Busy summer.
Thank you.
Thank you. Thanks for coming over.
Thanks for having us.